Thank you and welcome back to All the Facts. I think it's only fair to continue and try and finish these slides today, because you can see that at the rate at which events are unfolding around the world and around the globe, we unfortunately have to get to more topics. We must strike while the iron is still hot, and it's in everyone's best interest for all of us to raise the alarm whenever we see danger coming. Before we go back to the slides, I just want to go back and clarify the last point I was trying to make, and it has something to do with this so-called active case finding. Active case finding means you go out there and you look for cases. Active case findings means you go out there and you look cases through screening and testing. We have already agreed and we have already demonstrated that the testing capacity in South Africa is very low. That means even if we go to the community and identify more people, we are not going to perform any more tests than we already are. And I have argued that there is no supporting data to say we can safely deploy 28,000 screeners in our communities. Take, for example, your grandmother in your village. Your grandmother has not traveled anywhere. Your grandmother has not been to the shops. She has been sitting at home. Now you want someone whom you don't know their COVID-19 status to come to your grandmother's house, and when that person leaves, they are going to the next house. I think this is unnecessary. I wish before they start this, we are given an opportunity to comment. It's okay to make policy, but in a time where there is very little parliamentary oversight due to the crisis, we need to hold the executive accountable. We need to understand what they are doing, and where we see risk, where we see a risk of flames, we must raise the alarm. I see a potential risk with 28,000 screeners in the streets. I still think we have not explored the current methodologies, the current measures we've put in place enough and conducted enough tests to say, let's go for screening. Let's just look at another point here. Who is at high risk of community transmission? The people who are at highest risk is everyone going to work. Everyone who is going to work, every essential worker is at high risk. So, how many essential workers have we tested? How many healthcare workers have we tested? How many soldiers have we tested? How many mine workers have we tested? How many people working at the tax rank have we tested? Screening cannot see the virus. Screening is non-specific. We need testing. I said let's take a sample of everyone who is going to work, because these are the people who are coming in contact with different people. We have learned a horrible lesson from South Korea. They are saying 60% of the cases can be traced back to one patient in South Korea. This is not impossible. This is a fact that we are learning from South Korea. Let's look at Josie Sentin. We have about 12 healthcare workers in a hospital in Johannesburg who have been tested positive. We have St. Augustine Hospital, which healthcare workers have been tested. This to me says we have an urgent issue to address more than the low-risk people who are isolating and staying at home. Let's take the money we are planning on screening and use it for testing instead, and test the highest risk people. Every day that one doctor, one nurse who is asymptomatic, who is infectious, who is positive, and who is working at the hospital, they are putting a lot of people at risk. Every single policeman who might be positive, asymptomatic, conducting a roadblock, coming in contact with hundreds of people, we are sitting on a fire. That fire will explode and we will have no answers. So let's test essential workers. They are on the front lines. They are fighting the virus head on. The people who are staying at home must come forward when they are symptomatic or when they are worried. It will not help us to go knocking on everyone's door. It is defeating the whole point of isolation, social distancing, physical distancing, and staying at home. We have told people stay at home. Why are we changing the message? Let's deal with the people who are in the streets, the people who cannot stay at home. I would love to stay at home. I have to work. I am at work right now. I am actually thinking of getting tested myself tomorrow. My message will be to say, if you are still going at work and you can afford the test, please take the test. You will help improve the statistics. We have said South Africa has conducted 0.14% of the population. That's the number that we have tested. Do you see how far we are from testing 1% of the population? We are very far. So if you can afford the test, if you are still going to work, that is very important. If you are an essential worker, if you are going to buy essential things, if you have not been fully isolating, if you were unable to buy in bulk, some people did. We criticize those who are doing panic shopping or bulk shopping, whichever one way you want to look at it. They don't want to leave their houses because they want to social isolate. I believe the idea of door-to-door knocking on people's door will not bear us the fruits that we wish. In fact, it might put people at risk. I have said if just one person out of these 28,000 people going door to door is positive for the COVID-19 and they are asymptomatic, the risk is not one that we should take. I have suggested that the government, since they are so insistent on unleashing 28,000 people for door to door, the very least they can do is to test a sample. If you are saying you are unleashing 28,000 people, test 1% of them or test 10% of them. You see, you take 2,800, you start with 280, that's 1%, I think. And then you go to 2,800, I think that's 10%. And you see, if you test 280 of these 28,000 door-to-door screeners and you find that a lot of them are positive, that is justification for you to test a higher percentage and see, are we not unleashing the virus unknowingly on people who are isolating? I think the message has to remain consistent, and the message, as far as they've been saying, is that stay at home. Why are we going to disturb people who are staying at home? Let's at least do what they call due diligence. Test a sample of these people. Please. So we can go back to the slides. I think we were on slide number, we were here on slide number 21. Current stages of COVID-19 of SA's response: preparation, primary prevention, lockdown, surveillance, and active case finding. We have already dealt with some of these. The reason for that is because nothing happens in a chronological order. It's not one after the other. This is a web. For me, this is a web of interlocked, interchangeable, not necessarily interchangeable, but interlocked processes that should go hand in hand together. Community education. The most important thing for me about community education is that we need a clear and consistent message. Wash your hands, stay at home, use a mask if you have to go outside. The mask must be a cloth mask. Avoid buying N95 mask. And we keep repeating that same message. So we cannot tell people stay at home and the next thing somebody is knocking on their door. That is just what I was trying to explain. Surveillance. Who do you surveil? Do you surveil positive people who are infectious? Do you isolate them in a facility? Do we have the capacity to isolate everyone? Those are questions that need answers. The same way that the question of establishing lab capacity. I think we have spoken a lot about testing. It's reliant on the lab capacity. Lab capacity has a ceiling. You cannot go above that ceiling unless you create new testing modalities. The one I've been talking about, point of care testing, and I said we are waiting for other countries to make a test for us. They are going to charge us a lot, and we are going to pay a lot for a test that is coming from elsewhere. I repeat, we have the expertise, we have the scientists, we have the technology. I don't know if we have the money and the interest to create our own test, but I think we should. It should be actually a priority of the government to come up with their own test kits. That is just my opinion. Primary prevention, that is all interlinked with community education. The borders were closed. No one knows when the borders will be opened. That depends on what is happening around the world. Closing schools, reduced gatherings. No one can tell you for sure when schools will be reopened. This will all depend on the curve. The only way we can know what the curve is doing is if we test enough people. Currently, we are not. Lockdown. Well, this one is interesting and we have to do a little bit of mathematics for the lockdown. Okay, here's the page. Yes. So, South Africa is a country with provinces. We are currently on a full lockdown as enforced by the army. No one knows why we went straight to the army. Maybe the commander-in-chief felt that the police and the security officers and the traffic officers will not be enough to enforce a lockdown. So we went straight to the top and we brought in the army. The initial cost for the 21 days deployment is 641 million rands. Last week, the president announced the extension of the lockdown by 2 weeks, 14 days. Unfortunately, he didn't say anything about the cost. So I've done a basic mathematics and I think we can conclude from there. I don't know how accurate this will be. And it's simple. We solve for X. 21 days cost us 641 million. How much will 14 days more cost us? the number works out to 427,333,000 rands. So we are prepared to spend 1.68 billion rands. Yes, we are spending 1.8 billion rands, 1.68, I'm sorry, 1.68 billion rands, on, 640, excuse me. So 641 plus 427, this will be 1 point, so around 1.2, not 1.68. So this will come to around 1.2 billion rands, ZAR. So the question we should be asking ourselves is, how long can the government maintain and sustain a military presence on the streets? That should be a very serious question for us. How long can the government fund a military deployment on the streets? I will not go into the issues of police brutality. The cases are still ongoing. I respect the law and the constitution, which is the supreme law of this country. We will wait for the findings and the results of the postmortems. But on a cost basis, does the Honorable Tito Mboweni have enough money to give the army to continue with enforcing the lockdown using the military and their big guns in the streets? So if we are saying there will be a partial lockdown until September, that is still coming up in the slides, can we continue funding the military to be on the streets for that long? That is just something that we need to think about. Active case finding, we have dealt with that in detail. That active case finding using screening is undesirable. We need to do testing of everyone who comes forward and everyone who is at high risk. So I cannot necessarily talk about this slide because I have already said that things do not take a chronological order. We need to test to be able to make better graphs. What should we do this week? Follow the lockdown rules and monitor community transmission by average daily cases and positivity screened. I say we need to test more. We need to invest more money in our testing capacity. We need to test more. Community transmission levels to guide next steps and the lockdown. All of this is calculated from only testing 0.14% of the population, most of them done in private. So I can't say. Community health workers rate. I can't talk about community health workers rate when I don't know how many community health care workers have been tested. Abrupt return may increase spread. Well, I don't know. We are not testing enough people, so I don't know. If we start finding more cases, it can just be easily because we are testing more people. From around the world, the more people you test, the more cases you find. New York State is testing more per capita, is performing more tests per capita than any other country in the world. New York State, they have the highest cases. New York State has more cases than any other country. It's a state in the United States of America, So the more tests you do, the more positives you find. Hotspots. We have already dealt with hotspots. GP, Western Cape, KZN. What is happening at St. Augustine's? what is happening in the hospitals, it makes sense. Private hospitals, that is where more people went to get tested. So it makes sense that we are now seeing fires starting around private hospitals around the country. It makes sense. So we need to perform more tests. In fact, if you are finding more than 10 cases in one hospital, it is desirable to test everyone who works in that hospital. The risk of them being exposed is very high. So you want to see hotspots, test high risk people. We have already mentioned high risk people is basically everyone who is still going to work, everyone who is still walking around. Medical care, surveillance on case load capacity and capacity, managing staff exposure. I just spoke. Hotspots, I said there is no chronological order. So to me, these are just headings, not stages. A hospital becomes a hotspot. We have seen in Italy, the virus can spread very fast in a hospital. So you must manage everyone. Staff means all essential workers. So we need to test more essential workers. Field hospitals for triage. Well, the Prof even had a picture of the field hospital here called the Javits Center at Central Park. I spoke 2 weeks ago that the U.S. Army Corps of Engineers has been deployed to New York to assist in building a hospital. This place is not necessarily for triage. It is actually to take the overload of cases from the whole state of New York. So you build a field hospital that is exclusively for COVID-19 so that you can get more patients who are positive out of hospitals to avoid the hospital building from becoming a hotspot. That's just a point of correction. Governor Cuomo explains this in details in his daily briefings. Expand ICU bed and number of ventilators. So this one is very interesting because 2 weeks ago, the MEC of Health in Gauteng spoke about 1,500 ventilators. I said one ventilator is 25,000 USD. I said buying 1,500 ventilators will cost around 700 million rand. So the question about ventilators is simply, how many do we need? How many do we have? Remember, the ventilators that we have, we are already using them. So you need to know in average what is the ICU occupation throughout the whole country, both in private and in public, and ask the Honorable Minister of Finance to make funds available to buy ventilators and to create more ICU beds. Aftermath, bereavement. This is not stage 7 because 25 people, may they rest in peace, have already passed away from the virus. So we are already in bereavement. Psychological and social impact. So we have people staying at home to protect those who are working. So the question is, are the people who are at work receiving any psychological support? Healthcare workers, frontline workers, minors. The virus is depressing. You can't see your children because you don't want to expose them. You see, when you come back from work, you are scared. You are anxious that you might infect your family. So people need support. The fact that more than 50 people cannot attend a funeral, a standard funeral, means people are already anxious. I don't know what it is like to have a funeral with 49 people, but people are already affected psychologically and socially. Ongoing vigilance, monitoring antibody levels, vaccine, ongoing surveillance of new cases. So you might have noticed in the news that the DRC was supposed to declare itself Ebola free on Sunday, and they identified 2 cases of Ebola. So there is still Ebola circulating around in DRC. So the virus doesn't miraculously disappear. There are 2 ways that we handle the virus. We develop an effective vaccine, or we achieve herd immunity. Unfortunately, with herd immunity, people must get infected and people must develop their own antibodies towards the virus. Unfortunately, an unacceptable number of people lose their life. So our only hope is that we must get a vaccine. That unfortunately might take up to 12 months, which speaks to the issues of mitigation. How long do you keep people in lockdown? We want to talk about social impact. We are not talking about economic impact. A lot of our people do informal jobs. That entire sector is closed. Can people who work at a salon afford to be on lockdown for 5 weeks without income? Yes, the government is talking about social support. How many people do you know have received their UIF? How many small businesses do you know have received financial support? Those loans, are they forthcoming? What is the plan to keep people fed and make sure everyone is able to pay their bills? If the lockdown, we are now in in April. So if we are talking of peak in September, then we must understand that our people simply cannot afford to be on lockdown for more than 5 weeks. We are in the 3rd week of the full lockdown enforced by the army. Today there were protests in Cape Town, the Cape Flats of Manningbek. I hope that does not continue. People are fighting for food parcels. So the government must understand that you need to fund the lockdown. In America, the government is offering people $1,200 to pay for their bills. I don't know if that will be enough. But governments all over the world are funding the lockdown. People need financial support. Businesses need financial support. On top of the 1,200 rents that people are being offered in the United States, one of the things they're doing, well, they have money, so I'm not saying we should do it like they are doing, but a small business that is able to retain its workers and continue paying its workers will not have to repay the loans they're taking from the government. Of course, there is a lot of details into that, but I'm just saying, an extended lockdown will require money. We will have to decide, are we using the money to fund a military operation, or are we using the money to keep our people fed? Poor health access, we have already spoken about that. The coronavirus is not causing health problems. The coronavirus is exposing healthcare problems. Are we saying we have been having enough ventilators all along? No. The coronavirus is showing us that we need more ventilators. The coronavirus is showing us that we have a lot of underlying medical conditions that we could be treating better. The coronavirus is showing us that we could be treating the flu epidemic better. So voluntary partial lockdown until end of September. So we need to protect people. We need to protect lives. The virus is not going to disappear into thin air. Ask President Donald Trump. He said in March, when the summer in the Northern Hemisphere comes, the virus will disappear miraculously. Unfortunately, that's not how viruses work. So there's a question. Thank you, Andile Kari. I will answer your question, my friend. Thank you for watching. Thank you for engaging. This has to be interactive. So we might have to be on lockdown for a very long time, which is why the government, need people's cooperation. People who are unemployed, for example, need support. Support that they must understand that the economy is not reopening. There is no hope of creating new jobs. To be able to effect a lockdown that is extended, we need to support the vulnerable of our society. Big cities, field hospital, that is definitely needed because, as I've already said, the virus came in through the airports of the big airports, the big three, OR Tambo in Johannesburg, or Cape Town International Airport in Cape Town, and KZN. Those are the big cities with big resources, but they might need field hospitals because they are seeing more spikes. If we test more people, we will be able to be conclusive. We cannot just say it will only be the big cities, even the villages, because people have traveled from the big cities to the villages. So even the villages which have small hospitals might need field hospitals. So we cannot say conclusively that only big cities will need the field hospitals. Getting staff ready for the exponential curve. Hospitals with makeshift ICU, more ventilators, and PPE. As I have already said, this is not a chronological thing where you say, today I'm doing this, tomorrow I'm doing that. We already need PPE today. That is why last week, Nehau took the government to court. Even though they have settled out of court, that was indication that we need PPE now. I've just said that we do not have enough ventilators to start with. So we don't only need ventilators because of COVID-19. We need ventilators because we don't have enough ventilators to start with. We don't have enough staff, but that is not going to be solved now. So there are people who are unemployed, healthcare workers who are unemployed. Let's bring them into the system now. In New York State, they have, sorry for the interruption, technological glitches. I was just saying that if you look at the state of... Are we live? I think we're live. Apologies, technological glitches. I have said that it is raining in my village, so it is raining in my village, so the network is a little bit on and off. So I think we're live. And I was trying to make a point that getting stuff ready, that means we must address a chronic issue that we have been having. We have not been having enough staff in all of our hospitals throughout the country. There are people who have the required training who are unemployed. Let's employ them. And I was taking a lesson from New York State, where they have already employed more than 6,000 retired and unemployed healthcare workers. On top of that, the army has sent an additional 1,000 staff consisting of ventilator technicians. I have not answered your question, Andile. I will answer your question. I was just saying that the network is bad due to the rain. I was saying that in New York State, they've already employed more than 6,000 additional staff. The army has sent them 1,000 additional staff consisting of nurses, doctors, and ventilator technicians. We have a lot of nurses who are unemployed because of a lot of things that have been happening. Let's employ them. There are unemployed doctors. Let's employ them. That requires funding. So the Honorable Minister of Finance has to be involved. We cannot build additional hospitals without funds. That requires money. So the conclusion was that SA has a unique epidemic trajectory. We have, in the past 2 hours, argued that we cannot make that conclusion for sure. We have only tested 0.14% of the population. So let's test more and have a better graph. The exponential curve is almost inevitable. We can't see that unless we test. Lockdown has bought SA some time, about 4 to 6 weeks. We have said that the lockdown has only been in place for 19 days. Today's day 19. Yeah, well, it's a brand new day. It's Wednesday, so it's day 20 today. So we cannot make that conclusion. We don't know how effective the lockdown is yet. It's too early to tell. Systematic approach to keeping infection low while easing lockdown in stages. We have just argued, how long do you keep people in lockdown? You need to give them food and supplies. So the lockdown will have to be eased at some point. How? I am not certain. But what I'm certain of is that we don't have the money to continue with a full lockdown indefinitely. Well, we need to work on a vaccine. Focus shift to stage 5 of hotspot identification intervention. I have already said that we know the hotspots. Go there tomorrow morning and test all the healthcare workers at that hospital that has 12 healthcare workers who are positive there in Sentin. That's a hotspot. I have said that all essential workers are high-risk people. Test them. Preparing for peak. You can't see the peak if you are not testing enough. So thank you for staying with me. There is a question that said, what are we doing with the bodies of the deceased patients? Well, there are regulations on funeral. South Africa has only seen 25 funerals. In some countries, burials. In countries where they are recording more than a large numbers of deaths, the burials, if you follow what's happening in Italy and Spain and the United States, burials are being conducted by the army and other official personnel. In Italy, families are not allowed to be at funerals because they are trying to minimize the spread. So my answer to that is that at the moment, I am not certain how the burial guidelines in South Africa are, because we've only had 25 deaths. So those are some of the guidelines that must be made clear. All I know at the moment is that funerals in South Africa are limited to a number of 50 and below. So that is my answer to that. We have come to the end of the response to the lecture by Prof. Karim, a brilliant lecture in itself, but science requires that we do not accept data as it is. Science allows us to analyze and critique. This is not a personal attack on the prof. This is not a personal attack on the minister. This is not a personal attack on the committee. I trust the work that the committee is doing. I'm saying, as citizens, we have a responsibility of holding the executive accountable. We have to do mathematics, we have to ask questions, and we have to demand answers. We have to demand answers. We deserve explanations, and where we don't understand, we must critique. As South Africa, we come from a very, very dark place, where a sitting head of state said, a virus does not cause a syndrome. You know what happened. People were denied ARVs. People had to go to court for the court to declare that ARVs must be supplied to people. So we must keep critiquing our leaders. It's our job. It's our job to critique them. We come from a very dark place. A lot of children today have been saved by the extensive ARV programs that we have. People who were born in the year 2003 are celebrating their birthdays today. Those who were born to mothers with HIV, they are celebrating their 17th birthday this year. Some of them are HIV negative because the prevention of mother-to-child transmission programs have worked. The evidence is there. The evidence is there that the war that was fought in the courts, at the Constitutional Court, to declare that ARVs are a human right and that people with HIV must be given ARVs. That war was won in 2002 at the Constitutional Court. Today we have conclusive evidence that ARVs are life-saving. There is no argument about that. It's conclusive. Unfortunately, COVID-19 is a very young virus, SARS-CoV-2. We have only started learning about it more, which is why I believe we must spend more money to understand this virus. That is why I'm saying we must test more people to understand this virus. We cannot draw conclusive curves and analyze the trajectory conclusively when we do not have enough tests being performed. I believe my advice to the minister is that his attempts of testing 36,000 people is the correct approach. I disagree with screening. We can debate that if he is available. I would like to debate with the whole team if they are available to try and give advice where we can. I don't have answers. I have more questions than answers. But I believe through dialogue, we can come to a better conclusion of how to go forward with testing and screening. I have said screening is non-specific. We need testing. We need to create our own test kits. That is my message. 0.14% is not enough. Thank you. Good night. Stay at home. Wash your hands and help the needy without getting too close. Just send them money to buy food. Remember, that starts with your extended family. Let those of us who are still receiving an income, let's help our extended family. Let's not wait for the government to bring us food parcels. Of course they should. It's our tax anyway. So, but let's help our extended families, guys. And those of you who can afford to get tested, please get tested. We need more statistics. Thank you. And we will continue talking about this pandemic. It's our responsibility to critique. It's our responsibility to point mistakes where we think there are some. We don't have answers, but if we talk, we might get the answer. Good night.